guys. So I was asked today to talk to you guys about how to talk to vaccine hesitant people. And so I think the key thing to know about vaccine hesitancy is there's a difference between being hesitant and being anti-vaccination. If you have someone who comes to you at a vaccine event and they are just purely anti-vaccine and say, I will not get it, under no circumstances am I going to get this vaccine, say thank you, we're here to help, and let them go. You are not here to convince that group. It's not worth the fight. Sometimes they just enjoy the fight. Don't get involved in it. But there is a whole different group, and that's most of who we're targeting, which is people who are just hesitant, people who have questions, they're curious, they're not sure about something they've read online. That's who you really want to talk to. So if someone comes to you and says, no way I'm ever going to get the vaccine, say thank you, have a nice day, go about your day. But if they come and say, well, I've heard X, Y, or Z, then you could potentially have a conversation with them. But one key thing is we never coerce people at the Department of Public Health. So if someone doesn't want to get vaccinated, they don't have to. But if they're interested or they have questions and you can help them understand the vaccine better so that they can get vaccinated, please do. Couple common questions we often get questions about, just want to have you guys be prepared to answer. So the most common one is side effects. People say, hey, I'm worried about side effects, and you want to be comfortable talking through the side effects of the vaccine. What I always tell folks is the most common side effect is a sore arm. And then depending on the vaccine, about 10 to 20% of people will have flu-like symptoms afterwards that last about a day. That's by far the most common. And then you always want to tell folks that very, very rarely people have allergic reactions to the vaccine, but we've got medical professionals here and we'll take care of you if that happens. You are going to likely get questions about the clots related to the Johnson & Johnson vaccine. A couple important things there. It is only related to the Johnson & Johnson vaccine. We've never seen those with Pfizer or Moderna. So if someone's worried about clots, we always carry some Moderna with us, so we can always give them one of those. But for the clots, it's in people who are women under 50, and it's still incredibly rare, and it's still safer to get the vaccine than to get COVID-19, which dramatically increases your risk of clots. Those are some of the key things that I tell folks about. But if someone under 50 is a woman and wants Johnson & Johnson, they can still get it. You just have to counsel them about the risks and benefits. The one group we really don't recommend Johnson & Johnson for is pregnant women. But Pfizer and Moderna are incredibly safe in pregnancy. We have good safety data, and you can tell them that. You can also talk to them about getting vaccinated protects the baby, and also protects the baby if they're breastfeeding as well. So there's all good reasons to vaccinate in pregnant women or women who are breastfeeding. One thing we do often get questions about is the idea of fetal cells in the vaccine or aborted fetuses in the vaccine. There are no fetal cells in any of these vaccines. The Johnson & Johnson vaccine was tested on a fetal cell line, and so if someone wants to avoid those, they could potentially get Moderna or Pfizer. If someone brings that up, it can be helpful to note that the Pope himself has said that getting vaccinated is a moral imperative, that it is something we do to take care of our communities. Otherwise, you sometimes get questions about fertility. There's some stuff online saying that this will affect your fertility. It does not. There is no plausible medical way for it to affect fertility. And that's the best way that I tell folks, is that there is no evidence of that. And in fact, there's no way that we can imagine that it could happen. That's just an online rumor. And then the last one that I tend to talk about is just thinking about risks and benefits. So people talk about kind of these rare possible side effects of the vaccine, and all of those side effects that people are worried about, whether it's clots, whether it's inflammation, all those kind of things, are dramatically more likely from COVID-19 itself. So it's always better to get vaccinated than to get COVID-19, regardless of your age or risk factors. And then I just stress that this has been heavily vetted, heavily studied, incredibly safe, and it is something that 95% of doctors have already gotten. And that if you've been vaccinated yourself, it's actually more compelling to people to talk about your experience and say that you're vaccinated, you think it's safe, and that your family is, even more than to get into the data. I know Siri and Money are here, so do you guys have any other questions that you've come up with when it comes to vaccines that you'd like people to be able to answer? I surprised them.
I think that one common question that I do get is concerns about how it is still possible to get COVID with the vaccine.
Sure.
And so maybe some people say, well, it might not be worth it. I don't see the point. You can still get COVID even if you're vaccinated.
Sure. So if someone says, hey, you can get COVID anyway, it's true. Nothing is 100%, but your risk of getting COVID is dramatically less if you get the vaccine. So it's 95% effective vaccine if you're talking Moderna or Pfizer. And what you can say is you also have basically zero risk of hospitalization or death if you get this vaccine. So if you get COVID, it's not going to kill you. And you're still really, really unlikely to get COVID if you get vaccinated. So it's worth doing. It's a good idea. The other one we do sometimes hear is folks who say, like, well, I've had COVID, so I don't need it. The key thing to know there is right now we are seeing immunity from COVID infection ends at about 90 days. So after 3 months after you've had COVID infection, you could get it again. But if you get vaccinated, then that lasts quite a bit longer. We're still learning whether or not we're going to need booster shots, but we think that this is going to last at least a year if you get vaccinated, probably longer.
Great.
Thanks, Dr. Perry.
No worries. So yeah, key takeaways are don't coerce anybody, answer questions. If they are still hesitant, just give them the information and they might take it home and talk to folks. What we want the most is for them to have a positive experience with the public health department.